All right, Zaid, well, I want to welcome you to the show today.
Thank you so much for having me.
Yes, I'm really excited to have you on the show because I think that this is the time to shine as an IT leader. This is the time where you're cashing your chips because we're all running digital businesses, and regardless of whether we're running a brick and mortar or kinetic consulting shop, at the back end's digital. So, what are your thoughts on what we're experiencing right now?
Well, I mean, with the COVID-19 around, with the crisis we're having, the entire world is shifting. So, and I'm so glad that the technology that we have in this life, it came in the right time that everybody is implementing the right processes, the right technology, the right uh, pieces of tools that we may use on our daily life. This is really is a life changing where everybody in the office, welcoming and greeting everybody in the morning, take a cup of coffee and come to your office, start your responsibilities and tasks that you have on a daily basis. But now it's really shifted. Life is different right now. This is where opportunities of working remotely, people working from home. I heard a lot of my staff is saying that I'm more productive at home than rather than being in the office. More focused. I can just close my door and be accomplisher and make more tasks, like accomplish more tasks than being in the office. While I may be distracted. Some other people say look at this differently. They say like, well, we're at home, we have kids, we have background noise, we might not focus. So it depends. Uh, in general, I see myself, I'm more productive being at home, more focused, and I can accomplish more tasks on my daily basis rather than being in the office. And I see this opportunity saving for not only for the company but for myself. And we're not talking about saving only money, but we're saving the environment, we are saving the traffic, we are saving coming to the office, we're saving the light, the electricity, using the office. This is an opportunity for saving the nature, not only saving our money and saving our health, but saving the entire nature. So I'm so glad. I'm so glad to make this opportunity to use our technology. But at the same time, I feel bad for the COVID-19 and the loss we had for many people. But I want to take this opportunity, and I want the entire world take this opportunity and apply the lesson learned we are going through in the near future, not in the long term, but in the near future. I would say once we find the vaccine and all of that, life's gonna change, and we're gonna go through a different cycle of life where the social life is different in the office. Businesses are complete different. I see small businesses gonna grow as well as big businesses. Before the opportunities is what just for the big companies, while small businesses are struggling. But this is an opportunity now. As like I see, everybody is an equal. Uh, Big companies and small companies are not the same because everybody is like have the same technology. Everybody exposed to the same opportunities. Everybody is working like a big percentage working from home. So I just like I'm impressed of the lesson learned that we are going through, and I hope that the entire world will make use of these lessons learned and apply it in the very near future on how to coming out for the upcoming months.
What are you right now happy about regarding how things are playing out? Like what is working out better than you thought would 2 months ago for you in your business?
Business continuity is really important as we are heading to, we are in a COVID-19 era where a lot of people working from home. So the more focus on I believe that most of the leaderships are focusing, how can we make sure our staff are really doing the job? How can we measure their performance? How can we make sure that they are meeting the deadlines? Well, there is a lot of tools that you can use for to measure the performance, but at the same time, there's a work ethics. What I learned for the last 2 months, and I'm talking from the IT perspective,
Yep.
my team were working 100% from home, and they were doing great. I can, being an IT, we have a help desk tool we're using. I can see how many tickets being completed, how long did it take to complete a ticket, and all of that. So I'm talking about from the IT perspective, and there's for other departments, there's other measures that you can measure the employee performance. But this is like the big question came from the leadership. How can we make sure that our staff can do their job while they are at home? At the
Yeah.
same time, from being an IT leader, I want to make sure that the company infrastructure is solid and can contain the capacity of and the amount of people they're using VPN
Yeah.
connections and dialing from home, and making sure that our servers are up and running and can handle the capacity and the number of people can dial at the same time, work on the same application. So this is my biggest concern. Everybody, and I believe other IT leaders, are very comfortable being in the office and can make sure that I can watch everybody and see
Yeah.
this closely. But now the challenge is how can I make this happen while I'm working from home and my servers are away from me or on the data center, and what could happen if the system slow down on
Yeah.
everyone.
Now, are
And
you what help desk system are you using?
so in terms of ticketing system,
Yeah. In
we're
terms
using
of,
ServiceNow.
oh, ServiceNow. Okay. And how many employees in your company, Zaid?
Around 500 plus.
500. Okay.
Yes.
And is everybody regional in the Mid-Atlantic, or is it around the country?
Well, we have 6 offices. 5 offices is between DC, Virginia, and Maryland,
Yep.
and we have one office in Philippines.
In
Uh,
Philippines. Okay.
yes.
Yeah. I
So
mean, you got a substantial amount of people you got to support.
yep, like I mean, 500 plus organization, and we're talking about over 300 of them is medical staff. As you know that the company I work for is for support the healthcare
Yeah.
industry, which is this is my background. If we can step back a little bit, I've
Yeah.
been in the healthcare industry for the last 10 years
10 years.
of
Okay.
my life, being from the supporting the IT infrastructure, project management, and director of IT, being in different roles. But I dedicated my life and my focus on the healthcare industry, and I
Okay.
believe in IT that will change the world. And this is an opportunity for me also to mention how the technology being really implemented properly in the COVID-19 era, where telemedicine became really, really important. So,
Yeah.
for example, in telemedicine, there's a lot of tools that we organization been using, but for the small businesses, some organizations start using even other applications like WhatsApp, MS Teams,
Yeah.
FaceTime,
Yeah.
because some organizations, especially small businesses, were not ready enough for telemedicine. And if the patient is already COVID-19 positive, then it's really hard for the medical team to make like daily visit or weekly visit, unless they are very prepared and all of that, and with the you know N95 and all
Yeah.
of PPEs and all of that. There were shortage in the entire country. So while we're waiting for all the PPEs to be delivered, we have to start like virtual visits and see who's qualified, which patient is qualified, which patient is not qualified because they are not positive COVID-19.
Right.
So
Right.
telemedicine is where the technology that we were using in the last few years, but starting the
Yeah.
last few months is where
Yeah.
heavily
So,
people will realize that we don't need to have our patients to come to the clinic, or we
so
don't need
let me just pause for one second. So say you, just so listeners know, you're a big chunk of your users are are home healthcare, correct?
yes,
They're used to going to home. Okay. So this
yes.
is huge. This is really cool. And I was hoping the conversation would go this way. So, I think I know we've made more improvements at Red Zone in the past 2 months that would normally take 2 years. I mean, in another month from now, it might be 3 years. I mean, the amount of stuff that we were dabbling in, and now we have the chance to actually get it done, the things that we want to get done. And so how many people are dabbling in cloud, dabbling in telemedicine, dabbling in different things, and now all of a sudden we have this thing happen, and we're like forced. We got to do it, and I don't mean that forced in a bad way. I mean, but it really bends us in a strategy towards a certain direction. So I'm really curious. Do you see that you're going to have to go 100% telemedicine, or do you think it's just going to be both? You're just going to have both offerings?
Well, it depends. I mean, it depends on the type of visits. So again, I mentioned that already, but the patient qualified for the virtual visit or not, because
Okay.
virtual visit does not only include of doing basic measurements for the patient needs, but telemedicine needs some equipment. So we might need to send equipment in-house and educate the patient how to use it, while we can do it remotely.
Okay.
So how to like measure temperature, how to put like
Yeah.
your pressure and all of that. So there's some machines, some tools, medical tools that we need to send in-house, keep it there. So when we do the virtual visit, it's going to be easy. Other big companies nowadays is doing a package. So they're sending package to the patient house. This
Sure.
package includes all the tools required for them to do the visit,
Wow.
virtual visits.
I love that. You're going to need to get into VR. So people put like a VR headset so you can actually do remote, like people can see what buttons to press and all of this.
Yeah, this is happening. It is happening. It's happening very soon. We might be seeing that in the last few months. We were looking at this like it's going to be a long-term plan, but now it's different. This is going to happen. It's happening right now, actually.
Yeah, I mean, a lot of people say, well, these are like topics that I'll do it when it gets here. A lot of these technologies are here. The question is, we've never been forced to do it. Like we've never been forced to have 100%, not like 20% of the senior staff, but like 100% of remote workers. Now we have to come up with remote delivery models. Similar to us, there's virtual firewalls, but what happens if someone wants a physical firewall and we can't get on site to do the physical, implementation, but we could do it remotely if they're virtual. So it's the same thing with like DoorDash and cooking your own food in restaurants. It's like, all right, I get 3 options. What do I want? All of them. I want all the options. I want 3 options that I want to choose in the moment. And so it's funny. I think a lot of business models are going to have to be fluid and flexible to get the job done, regardless of the situation. And it should be about the customer. What do you feel most comfortable with? Oh, well, I have COVID. You probably don't want to come on site. Oh, well, that's true. So I'm going to ship you a box and we're going to do it all remote.
Yeah, but I mean, again, it's opportunity. This is I'm so glad that the world now is moving so fast. So we were moving. I'm not saying that we're slow, but now with having this around is really the entire world is moving very fast, and not only very fast, but everybody is very excited for the new technology. Everybody is
Yeah.
able to use the technology, and I'm talking about the doctors and nurses that they use the technology on a daily basis, but now it's different.
Yeah.
Now they are more exposed of using the tools for like telemedicine and the cameras and the virtual visits,
Sure.
how to be prepared and to create accounts and all of that.
So this is going to be called the Future of Telemedicine episode with you, and talking about how you see, because I think this is the time for CIOs and IT leaders and title equivalents to cash in their chips, because you put a lot of hard work in, Zaid, through the years, and sometimes it wasn't too long ago, not just with you, but with a lot of leaders, that the business doesn't take IT seriously. Well, guess what? Those days are over. You're an enabler of the future, period. End of story, right? And it's not just you, everyone, the whole CIO IT leader community. What are your thoughts on that?
Well, I mean, I'm glad that I'm IT. I'm glad I work for the IT industry. But I want to see myself which industry, like with IT.
Oh, which industry? Which industry?
Yeah, which industry. So I want to see myself. I worked for like financial exchange markets as an IT leader. I worked for other companies, small businesses, but I end up working for the healthcare because I have a mission and vision on
Mm.
how to apply uh, IT and the technology that we learn when we get exposed on a daily basis on the real life in the healthcare industry. How can I save a patient? I want to share an example. This has happened to me personally. So I was part of. I used to work for the Children's National Hospital, and I
Okay.
was part of the team where I implemented Zen Desktop for the entire hospital. And I was managing a team. We're doing implementation. We have to go to the ICUs, all the floors, and making sure that we once we get into the room, we have to prepare we wear gown and gloves and all of that, and be prepared that we get inside the room, patient room, and do the installation and preparation for the Zen desktop. This is for the doctors and nurses to log in and look at the patient chart and all of that. It happens to me that one of these days my daughter did not feel good, and we have to admit her to the hospital. What coincidence happened to me? This happened to me is my daughter got admitted to a room where I myself did the installation for this virtual machine for the virtual desktop. So is kind of as a life is karma, where I did a
Wow.
good job, where I implemented a technology to make sure that the doctor and nurse or the medical staff can come to this room, can do their job, can view the patient chart, and making sure that the patient is safe and can do all the medication and all the process that need to follow using the technology. And this room is my own daughter got admitted to. So
Wow. That's amazing.
that's for me. Fortunately, my daughter is good, and she's very healthy right now. She's playing around, and so I'm so glad to see her this way. But the lesson learned from my end is I'm so happy that I was doing my job and my goal and vision and mission to implement the technology where I can be part of the medical team to save people's life.
That's, I'm making notes of that because it's such a powerful, we can get wrapped up in the technology and forget the real purpose and the real mission of why we're doing this. And,
Exactly.
with any reason why we can sustain anyhow. And I think it's a real grounded perspective that you just shared, that it's a significant reason why that you can sustain anyhow, and then it's important. I actually have on my board is the was the ex-CIO. She was there for 8 years at Johnson and Johnson out of New Jersey, and she was the CIO of 100 CIOs. Each of those CIOs ran businesses that were $1 billion because Johnson and Johnson has lots of sub companies.
Mhm.
And she said, Bill, we have one of the businesses makes band-aids, and they make not band-aids, they make dressings for burn victims. And she goes, I'm not in the technology business. I want those bandages, those burn victim bandages, to be the best of the best to alleviate the pain and suffering of a burn victim. And she had she always, I mean, that's why she's on my board. She has a big mission and a big vision. But I love your story because that really resonates with me.
Thank you.
Yeah, for sure. Um, well, I just want to wrap up by, what do you think your if we're looking back on, if we're a year in the future looking back on this, Zaid, um, not just, we're past it. They've got the vaccines. We're now living whatever life qualifies as normal a year from now, and we're looking back on this. What do you think is what's a big home run for you? What's a big win for you as we look back? Like, what superpower has carried you forward, that you want people to remember you by, and you want to look back and be proud of yourself about?
Well, I'm happy to be the one of the IT leaders where I can implement the technology at the right time. I'm happy to be and working for a healthcare industry, healthcare company to support patients and to save patients' life. I'm glad that the technology was not left over, but used in a proper way where we can make use of it in a way that we can save people's life. Um, I'm proud of being of the IT industry, of the IT leaders, where we can change the entire world in a good way. And I'm proud of being an IT leader where I can be part of a team, my internal team or my previous team, where we can implement technologies to make life easier. So we're not talking about industry where, I mean, all industries are important, of course, but but I'm dedicating my life to the healthcare industry,
Yes.
where this is the way, this is my mission is to make sure that the patients, our families, our friends, everybody in this world is safe and being taken care of, not only being a doctor, but being an IT part
Yeah.
of doing a doctor visit.
Well, as we wrap up, I really appreciate you for grounding this conversation. I wasn't expecting the conversation to go this way, but I'm really glad it did. And I think it really highlights why you have been so successful in your role and leading your company in a very important time frame that we're in right now, overall, but also in this time frame of health and concerns of that nature. So, is there anything that you want to wrap up with, or do you feel like we've covered the main topics that you wanted to cover?
Well, we did cover a lot, and I thank you so much for giving me the opportunity to be a part of your show. This is really a way of conveying the message to everyone in all social medias or like other platform where we can reach out to the entire world and let the people know that we are here. We are IT support. We are supporting the all type of businesses, whether healthcare or other industries. But we are here to implement the technology where we can change the entire world.
You are. I have that belief, which is fantastic, and it's just a great message to share with other IT leaders. Thank you for coming on the show, Zaid. I appreciate it very, very much. And until next time, have a great and safe day.
You too. Thank you so much, Bob.
Okay, Zaid. Bye bye.